Hello and welcome to the I Love Me Lab show. My name is Gail Buck, and I'm an NLP Master Life Coach, meditation instructor, and a seeker of happiness. And each week, we're going to bring you an inspiring person or message to help you discover additional ways of self-care, self-love, and becoming a healthier, happier you. So thanks for spending time with us today, and let's let the show begin. Hey, everybody, and welcome back. I'm super, lucky and happy to have today Gary Mendell. And Gary, I've been trying to get on the show for quite a while, is the founder of and CEO of Shatterproof.org, which is a national nonprofit organization that is dedicated to reversing the addiction crisis, substance use disorder in the United States. So welcome, and thank you so much for being here.
Gail, thanks for having me.
Yeah. So I don't know if you remember when we met, but I have a son with an addiction as well. And so this is just close and dear to me. And I have a lot of people that I know that are eager to hear this after we record this podcast as well. So in sharing the information, are you comfortable? Are you okay talking to us about your son, Brian, and what drove you to start this organization?
Sure, Gail. Well, my career was not in nonprofit work nor healthcare. I was raising my family in a small town in Connecticut. And my older son, Brian, like many teens, the year before high school, right around that time, he started experimenting with beer and wine and weed. And unfortunately, like some, he became addicted throughout his high school years. And that led to Brian going to 8 different treatment programs over 8 years. And Brian and our family, but mostly Brian, tried his hardest. He, every time he would relapse, we would work with him to get into a different treatment program. And he tried his absolute hardest. However, on October 20th, 2011, a little over 10 years ago, I was woken up in the middle of the night by my cell phone ring and told that my son had just died. He was 25 years old, and he hadn't used a substance in 13 months. And equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame that he felt every morning when he opened his eyes, of all day long feeling like an outcast with low self-esteem, that caused him to wake up that morning, research suicide notes, write a note of his own, light a candle, and take his own life alone. And obviously, as a father, it doesn't get any worse.
Yeah.
And in answer to your question about Shatterproof, I really began to focus on 2 questions, all based on the Serenity Prayer. What could I have done differently as a father? And I turned to the first sentence of the Serenity Prayer, and I just had to accept that. But I had to also wanted to learn. And secondly, what could be done to spare other families of the tragedy our family had suffered, and my son, which is the second sentence of the Serenity Prayer, to change what you can and help others. And so I took what I thought would be 3 months away from my business and traveled the country, looking for answers to those 2 questions. I learned so much in those 3 months that I hadn't known: how big this was. Most people with a substance use disorder develop the disease before their 18th birthday. But the biggest thing I learned that rose above everything, that just destroyed me all over again, was I learned that all this research existed that was sitting in medical journals and not being implemented. Research that had proven without any doubt that if certain things are implemented in our healthcare system, in our local communities, in our families, significantly less of our young adults would use substances and become addicted while they were in high school. And another body of knowledge that had proven for those who had developed the disease to improve outcomes, comparable to anyone being treated for any other chronic illness. Yet all this information was sitting in peer reviewed medical journals, and hardly any of it was being implemented, which became to me a catalyst for our country needed an organization that would bring people together and organizations together to simply implement what the research had proven to work. And that's the vision of Shatterproof.
Yeah, I read that it's based like on three pillars, right? The revolutionizing addiction treatment, ending the stigma, educating and empowering communities. Stigma, and I know from my own personal experience, not only the stigma attached to the addiction at all different levels. I mean, with the individual with the substance use disorder, but also to the family. Going into a hospital because your child is overdosing, and medical staff being wonderful, and also experiencing the total contrary. Like they're a druggie or they're an addict, and that's the mother of the addict, and she's just
Right.
as disgusting. And I remember sitting there thinking, oh my God, they're judging my son, and they're judging me too without knowing anything about anything. So the stigma is huge. And what is it that Shatterproof does, in changing or working to change the stigma attached to this?
Sure. First of all, we spent all of 2019 and the first part of 2020 working with one of the leading consultants in the world who did all the work pro bono for us. And they, with a team of people on it part time throughout 13, 14 months, all pro bono, worked with me, and we studied all the research that exists on how to reduce stigma. We studied 11 social movements that had been successful in creating social change. We studied 100 pieces of published literature. We had hour and a half individual interviews with 50 experts who had gone through those social movements. And we developed a plan to do so for the disease of addiction, substance use disorder.
Hmm.
That plan that we published in June of 2020 lays out 3 actions that we must do, that our society must do: educate in a certain way, change language,
Yeah.
and change policies. And we divided our society into 6 systems: employers, healthcare, criminal justice, media entertainment, government, and large employers, or excuse me, all employers. And so for those 6 sectors, we've begun to develop content in all 3 areas. How do you educate, language change, and what policies within your sector need to be changed? So the plan was then built. Once we had the plan, you can't do everything at once. We
Yeah.
started with one sector, the public. How do we change communities, the public, and how they think about this disease? And we partnered with one state, the state of Pennsylvania, and we developed, which had never been done, a intervention, a educational program for the public on how to change the way that they would think about this disease. So an educational content as well as language change. We left policies to phase 2 because that's harder to do.
Yes.
And essentially, what the research shows of what works is something called contact based education, which is essentially short videos or a picture in a paragraph. That's scalable. It also could be speeches, but that's less scalable. But you're bringing the message to life with a human, and a human that can relate to the audience. So we sought out and we developed stories of 100 different people in the state of Pennsylvania
Hmm.
that all live in the state of different segments: white collar, blue collar, black, white, Latino, farmers, urban, suburban, etc. And we share those stories through social media
Mm,
through 100, no, it's over 100 now, community-based organizations. So we create the content, we give it to them, and they share it through their networks, and then we boost it with geo-targeting with a small amount of paid media, paid social media, to make sure the stories are going to lookalikes. So
right.
I'm getting served, white collar is getting served stories that look like them. Blue collar is getting stories that look like them. White's getting served stories that are white. Black are getting served stories that are black, etc. Farmers to farmers. And it's a simple message. It's, hi, I'm John. I work at Walmart. I've been there 20 years. I've been promoted 4 times. I'm now a store manager. I'm married. I have 3 kids. I coach Little League on Tuesday nights. I have weekends on barbecues on the weekends for my neighborhood. And I'm addicted to heroin. But I've been treated successfully. I'm in recovery. There's tens of millions of people like me in the country. And yes, you can work next to me. You can live next to me. I could be your neighbor. I'm fine. Life is beautiful when you're treated with evidence based treatment. And
Yeah, I
that you're
think
changing the perception of someone who's addicted to heroin, somebody sticking a needle in their arm in the back alleyway, to someone who's a productive, happy citizen in our society, which is
right,
most people who have a substance use disorder.
right. And I found, and I mean, I've been, in this space for, gosh, I think about 15 years now. And I find, and I'm very comfortable speaking with people about it. And the more you speak about it, you more that they find that they have somebody in their family circle or a very good friend that has an addiction too. And oftentimes it leads to tears coming out and then finally expressing it because maybe they've never told anybody or they certainly don't talk about it openly because of they'll use the word shame a lot or they're embarrassed or whatever it is
Absolutely.
that's surrounding it. And it's like, oh my gosh, I go, almost anybody you speak to has somebody in their close circle that is going to touch somebody.
Absolutely.
Yeah.
But Gail, the tragedy, but also the beauty of this, we can change this.
Yeah.
It's been done with other social movements. We can change this. And I can tell you, after 12 months in the state of Pennsylvania, we changed knowledge and attitudes about this disease with 4 million people in the state by
Wow.
15 points on average. Would you be willing to live next door to someone who has a substance use disorder? We moved it 15 points. I don't remember the exact percentages from what to what. We moved it 15 points. Do you think medication for those addicted to opioids is effective? Would you be willing to carry naloxone or Narcan, a medication that can save a life if someone's not
Wow.
breathing? We moved all this by 15 points. Because of the success of what we did in Pennsylvania, the state extended it for 2 more years, fully funded by the state. And now we're expanding into 4 additional states. We're going to go from 1 state to 5 states. And that those states represent 22% of the United States population. So more than 1/5 of the population is now going to have this intervention through us that we've created so successfully and implemented in Pennsylvania. Pennsylvania was 4% of the population. Now we're going to 22% of the population. So in answer to
Yeah.
your question, this can be done. There's no question. It worked in Pennsylvania. It's working in Kentucky, and it's going to work in 3 other states as we roll out in these 3 additional states.
Yeah, and I was looking through your website and all the beautiful information that I had no idea that the website is so full of links and information and resources. And even in my own experience at one juncture, my Joey's addicted to opiates and they put him on Suboxone. And for me, not understanding that sometimes somebody does need to be on another medication. I mean, this can be part of the process, or maybe it's going to be like that forever. I don't know. But not
But
being
Gail, let me just
educated
jump
in
in
that
for a
space.
second and say
Sure.
if Joey had diabetes and he was taking insulin for life,
Right.
fine.
Yes.
Okay, so you're addicted to opioids. If he were on Suboxone for the rest of his life, is there any, who cares? I mean,
Exactly. And that's my point. I mean, I didn't understand that. And I think a lot of people don't understand that because we don't. have the resources readily available. And I mean, Shatterproof is great because it has all that information in there, but there isn't a lot of, they have to hear about you. They have to find you. Or they have to find somebody like you to be able to share that information with them. So we don't think we're just substituting one drug for another drug, right?
Right. Absolutely.
Yeah.
I mean, insulin is providing what you need to live if you have diabetes. It's okay.
Yeah. You know, like you say, the stigma. And then I'm wondering, does Shatterproof do anything for example, like with, speaking about media, like with Hollywood? I mean, for me, I'm a movie addict, and when I'm watching movies, and then all of a sudden they'll say something about they'll use a term like the drug addict when they're talking about the lowest of the low. It's just like,
Right.
oh my gosh! I mean, that just flipped
Yeah.
a
So, in answer
switch
to your
inside me.
question, we are moving to, as we build out our work in Stigma, we're moving to other sectors. Remember, I mentioned six
Yes,
sectors? So, we
yes,
started with the public, partnering with the state of Pennsylvania. That's now
hmm,
going to 5 states. We just got a large grant from a large health insurer, Anthem, to now go into a second sector, which is what healthcare professionals, how they feel toward their patients and the medications that treat
yes,
those addicted
yes,
to certain types of addiction. And so we're developing as we speak right now, we're developing a new intervention, not for the public, but for healthcare intervention professionals. And we're going to be piloting it in 10 different locations, several primary care offices, several emergency rooms, and several residential treatment programs, 3,000 healthcare professionals. Run it for a year and compare knowledge and attitudes baseline to a year later. And then we'll start to scale that. And then the third category of the six that we're moving into is media.
hmm,
There are so many stories every single day in this country about this disease, written by wonderful journalists who are writing a compassionate story, but describing the person as an addict or a junkie,
yes,
just
right.
because they don't know any differently. But that changes the perception of somebody as a low life to a low life, basically.
Yes, yes,
And so if they can not describe the person who's addicted as a junkie or an addict, but as Johnny, who's addicted to drugs, no different
yes,
than Johnny who has diabetes, or
yes,
Johnny who has a substance use disorder or addicted to alcohol, then it's about Johnny. It's
right.
not it's not stigmatizing. And so moving into the third category, we started with the public partnering with states. Second, we're going to healthcare professionals. Third, we're going to the media and getting all the media using the right language. Fourth, we want to move to entertainment.
Yes,
So, stories that you watch on TV are not showing someone inappropriately. No, they're showing people with a substance use disorder, just like they have asthma or diabetes or
right,
heart disease, living a normal life. And yes, you can live next to them. Yes, they can be your friend
right.
because people recover and live normal lives most of the time. And if they're treated with evidence based treatment, it's almost all the time.
Yes, yes. Now, let's go back to, so Brian, did he start like with marijuana and drinking and things like that?
Yes. Yeah.
Okay, so yeah, my Joey too. And I know that when they start younger, there's a great, this is what I've read. This is my
Yes.
understanding, that when they start younger, there's a greater chance of the addiction, right? And of course,
Absolutely.
yeah, and their brain is forming. So
Right.
what could be, I guess it makes it more imperative, more urgent that the kids in school are educated in a way that they're embracing it and accepting it and understanding why they shouldn't use this, instead of just one more rule that,
Absolutely. If statistically, if you use substances for the first time at age 21, statistically, you are 3% likely to develop a substance use disorder. If you start using substances at age 19, you're 7%.
hmm,
17, you're 13%. And to the point where if you start when you're 13 or 14, it's about 25%.
wow,
And if you have ADD or anxiety or depression, it's higher. And if you don't have those, it's a little lower to get to that average. So, how do we move the starting age for our young adults instead of starting at 13 or 14? How do we move that up to 17, 18, 19, or even 23 or older, 21 or older, excuse me? It's less about education, as I learned. There's a whole body of research shows that it's less about educating kids about the dangers of drugs because that's not going to work.
Yeah.
It's more about certain programs that have been developed over decades they're more about raising healthy children. And it not only reduces the amount of substances they use. If you implement these programs in middle school, when they get to high school, 20 to 30% less of them use substances. And it's
So
less
are you
about educating on substances. It's more about um, making them comfortable with themselves and their decision making, and less shame and stigma if something were to develop. And it's more about raising mentally healthy children. And there's a whole bunch of programs that have been developed that you put into middle schools and high schools that have absolutely, unquestionably proven to significantly reduce the number of our teenagers who use drugs. They
Now,
tested
are
10.
those programs limited? Well, they are limited because what are the 2020 showed a 15% increase in people with substance use disorder.
These programs, it's what I talked about related to treatment. They're sitting in medical journals not being used. It's crazy. It is absolutely crazy. And we can only do so much now. The more people that join with us and partner with us as advocates and volunteers and donors, the more and more we can do. And that's one of the programs that are bullseye on our list to do next once we have greater funding. Right now, we have those three pillars that we're very focused on, but we'd like to add prevention programming as another one. But clearly, there's information about prevention on our website to help people,
Right.
but we need to grow bigger to move into the programming of all that prevention.
But that makes total sense. So instead of we're doing, say no to drugs campaign, which I guess they found was not successful, it's more about helping them feel confident in whoever it is that they are, and also maybe seeing why they want to embrace a healthy lifestyle. What this does to your
Absolutely,
body, how it makes you bigger and
absolutely.
stronger, and whatever the case might be.
And the good news is the results show that not only significantly less use substances when they're in high school, less suicide, less depression, less anxiety, healthier, more likely to go to college. It had more likely to ever end up being arrested. It's all the positives, not just substance use.
Right. Wow. Okay. So that's interesting because I had not thought about it that way. I had thought about more like an you know, drug use thing.
And
But you're right.
anybody that wants to learn
Embracing
more about it,
yourselves.
yeah, anybody wants
Yeah.
to learn more about it, go to communities that care. I'm not sure if it's .com or .org. I can't remember, but all the research exists, and it's on our path as we grow to begin implementation of that in a big way around the country.
That's beautiful.
And they can learn more. And again, we have a lot of information on shatterproof.org where people can learn as well.
Yeah. So, and you talk a lot on the website where it talks about the stigma that it's a chemistry, it's not your character, right?
Oh, of course.
The
Yeah.
addiction.
I
Yeah.
mean, no, I've never met anybody who asked to become addicted.
No. Right.
Kids do what they do in this society, and 1 in 10 develop a substance use disorder through no fault of their own. And even worse today, there are so many of our young adults dying related to fentanyl where they're not even addicted. They're just using occasionally. And substances like opioids, like Xanax, like so many different things are laced with fentanyl, and kids are just dying instantly
So I don't even understand why are they being laced? I mean,
because it's so
I don't
much
mean
cheaper. It's
who,
so much cheaper if you're
it's
a drug
cheaper.
dealer. If you could buy a Xanax pill for X and sell it for X plus 50% to someone looking for it, or you can make a Xanax pill or buy it much less expensively because someone made it so much less expensively chemically. You don't have to grow. You don't have to grow anything to make this. You don't have to grow heroin leaves or plants. You don't.
You're just
It's
creating in the
so much
lab.
less expensive and it's so much more profitable for the drug traffickers.
Right, and I believe that the drugs, that the deaths due to the drugs right now has increased dramatically as well because of the fentanyl. Is that correct?
Absolutely, yes.
Now, I was in looking at your website, your board of directors and advisors, and the reason I'm bringing this up is because the people that you have there as your advisor and board of directors, and is very impressive. Their their knowledge base and their careers and their paths are very impressive. And I'm bringing that up so that any listeners can see this is like a super serious, fast growing, healthy organization that you have.
Absolutely.
Right.
We're just getting more and more done each year. Our quality measurement system, which shows started in 6 states, now it's up and running in 10 states, and it'll be up and running in 14 states by the first quarter next year, shows transparently which treatment programs are following evidence-based practices and which ones are not. Because of
Hmm.
the size of these states, even though it's only 14 out of 50 states, it'll be almost half the United States population. So that program is growing across the country to a larger and larger percent of the population. Our policy work, our getting payment models and provider education, growing and growing around the country. Our Stigma program we already talked about, and our education program, more and more people are coming to our website and learning.
Yeah. Yeah. And I know going through the treatment centers, I think my Joey has gone to at least 18, and it can be. So I think a lot of times that we make a decision based, we're in this crisis mode. And so we start throwing money at some place that we think is going to help our child. And oftentimes, unfortunately, it doesn't, whether it's because of the place or because our
Yeah,
person wasn't ready or whatever. And then, you know, if you're paying cash, which was my case a lot,
yeah.
it's
And Gail,
goodbye.
that's why
You know
I
what I mean? It's like,
encourage you and all your listeners to go to Shatterproof, go to the
yeah.
section that is help, and there's a subsection there called find treatment. It will take you to our quality measurement system called Atlas.
Hmm.
And if you're looking for treatment in the 10 states that Atlas is running, or any state that's bordering those 10 states,
Right.
you'll get information on all the treatment programs or most of the treatment programs in those 10 states.
So, Gary, what recommendation, because I know that you not only were you were and you are in this experience, but you meet with parents all the time that are in this experience, and it can be emotionally just a hard, challenging journey. So, what resources, if any, do you have available for parents?
I would suggest that parents go to our website and go to the help section and learn
Okay.
there.
Yeah.
Um, Many parents have found comfort and community by coming to our walks. We have
Hmm.
7 walks in major cities across the United States. People can learn about, we have thousands of people at each walk, and that sense of community, of
Yep.
companionship, of all being together. I, it's the most powerful thing I've ever experienced. And if any of your listeners want to attend or yourself, it's on our website, our events. And it is so emotionally healing, I think, to be at our walks, whether you've lost a child, whether you have a child going through it, whether you have a child in recovery, whether you yourself are going through it or in recovery. Everyone's there, and they're so emotionally satisfying and healing.
You also have opportunity for ambassadors in your
Correct.
program, right?
We have
Can you tell
ambassadors
tell
for
us about
people
that?
who want to volunteer in different ways, whether it is helping at our events or um, doing a podcast like this, or offering to go to a public hearing where we're trying to get some legislation passed, or offering to work with us to draft an op-ed in a particular situation. Any way that people want to help. Um, it's not like one size fits all. And we also have a junior council where young adults in their 20s and early 30s can form community-based junior councils where a lot of people, all the same age bracket, if you will, work
Mhm.
together to help us further our cause. And we had one in New York, and now it's expanding to 6 or 7 cities across the United States. And all that information is on our website as well, if people want to work with us. I mean, every person that joins with us, we can do that much more.
That's fantastic. And so I encourage any of the listeners that are out there, if you want to get involved or if you just need some support or resources, helps you feel a lot better if you know a little bit more, to go to the shatterproof.org website and start searching for whatever it is that you want, or to get involved or to donate. It is a nonprofit, right? So you take
Absolutely, Gail.
donations there too.
Thank you. So thank you. Yes.
Yes, yes. And Gary, one final question. So this is a I Love Me Lab podcast, and this is all about self-love and self-care, because I believe that when you love yourself more, you're able to love others bigger and more deeply. And so if you were to give one word of wisdom to anybody out there who's listening, on a way to take care of themselves through difficult challenges, what would that one thing be?
If someone like your son has a substance use disorder, the one piece of advice that I would give is society is behind the times. I remember the last time my son came home for a visit turned out to be 4 months before he died. And we're on the back porch talking that last night about his favorite topic, New York Giants and Eli Manning. And
Hmm.
then the conversation turned to recovery, his recovery. And he looked at me and he said, Dad, 200 years ago, they used to burn women at the stake in Salem, Massachusetts, because they thought they were witches. And then people realized they weren't, and they stopped. Someday, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. Well, our society, Gail, in answer to your question, hasn't caught up yet. It
Yeah.
hasn't met my son's wish. To anyone with a substance use disorder, just because society is behind the times, don't feel it yourself. Society's wrong. You have an illness no different than diabetes. And society is catching up. And Shatterproof is going to ensure that society catches up faster. And they will. But in the intervening time period, don't let society get you down. Be the proof. You are Shatterproof. You have a protective coating. Be the proof that you are Shatterproof. And if you'd like, join with us to feel the emotion of helping others.
That is absolutely beautiful.
So
Beautiful.
thank you.
Thank you, Gary. Again, if you want to check out shatterproof.org and donate, or become an ambassador, or just grab the resources that you need so that you're able to help yourself or help the person that you love. And thank you for listening. Reach out if you have any questions. Again, Gary, thank you so much.
Gail, thank you.
And I hope to talk to you again.
I'm sure you will. Thank you. Likewise. Thank you.
Thanks so much for listening to this conversation. If you enjoyed it and want more information on our guests and resources, please visit ilovemelab.com. And please, if you enjoyed this episode, remember to subscribe and share with a friend. Hey, there's more great episodes to come. So until next time.